estrogen has over 400 functions in the woman's body, and so we don't want to deny estrogen for the final third of our lives. Hi, I'm Dr. Casebolt at Forum Health Greenville, and I'm here to talk about the recent article in the Washington Post that has come out featuring the work of Dr. Lisa Mosconi. Now, who is Dr. Mosconi? She is a PhD in neuroscience at an Alzheimer's Prevention Center up in New York. She has a very interesting TED Talk, which you can look at, and that's actually how I first heard of her. So the article talks about the fact that when women go through menopause, there are scientific reasons for personality changes, brain fog, anxiety, some of these sleep issues. There are actual biochemical reasons. So I really respect the work of Dr. Mosconi and how she's brought this to light. However, I do disagree with her conclusions. Her conclusions are that, well, if a woman goes through menopause, there are things like antidepressants, seizure medications, blood pressure medications that can help. My conclusion is diametrically opposite. Estrogen. Women need estrogen if they want their brains to continue to function. So I'm not exactly sure why she was hesitant to endorse what we know is so effective and so helpful, not just for our women's brains, but so many other parts of our body. So if you're interested, you can look this up on your own, but just know that estrogen is safe. It's the most effective remedy for the changes that happen when we lose our estrogen. So hope you'll check us out and come visit us if you have concerns about your estrogen.
Hi, Dr. Saxena here, Chief Medical Officer at Forum Health. Thanks for visiting our channel. Make sure to subscribe to get the latest insights and information on functional and integrative medicine.